I've been in this community 10 years and came out of residency feeling like I was fully equipped with the tools that I was going to need to serve the community and to really make a difference. But what I found is that there are many facets to health that I wasn't very well equipped to manage. And I think the benefit of integrating behavioral health is that we are seeing patients able to improve their health outcomes.
We applied for a HRSA small practice quality improvement grant. The focus of that was behavioral health integration. We weren't able to apply because we were a for-profit clinic at that point in time, so we contracted with a group in La Grande, Northeast Oregon Network, to actually be the grant administrator.
Our role was to manage the grant, to work as project manager, and the goal was to implement trained behaviorists into a primary care setting to work on patient activation interventions to really help motivate patients to make lifestyle behavior changes.
I think patients are really excited about this new model. I think they rightfully feel that it helps them to engage more in achieving their optimal health.
As of today, we have 2 family physicians and we have a full-time physician's assistant. We are the rural rotation site for OHSU residency program, so we get all of the second years. So we have a resident all the time.
We start the morning with a huddle, myself and the medical assistants, and most times a behavioral health coach, and we go through the list of patients who are coming in and we talk about what are the things they're going to need for the day.
We talk about who's where and which providers are available and who's precepting, and then also who's on the care team and what they're going to be doing for the day.
We have arranged a standard workflow, if you will, by which we can text to the behavioral health coach, and I'll tell the coach of the day, meet me in room 3 to talk about smoking cessation. And it gives us a chance to introduce the patient to the coach and do a warm handoff, and then I can leave them talking and they can actually get started on things.
If any of the providers want to make a referral for the behavioral health coach, it's a pretty simple process for the patient. In their follow-up note, they'll write in it, make appointment in 1 to 2 weeks with the behavioral health coach. So when that person goes to check out, they can make an appointment right then and there.
Behavioral health coach is sort of a hybrid case manager, if you will, and mental health therapist.
Our primary role is to support the work that's happening in the primary care setting. They're working with clients around a lot of different issues, and a lot of those issues involve health behaviors, how the person is doing emotionally or in terms of their mental health. And so our job is to come in and complement what the physicians are doing by providing expanded services so that they're not just dealing with the physical issues that they have, but we're really working at total wellness.
Anytime you start a new process, there are always some speed bumps, and what we ran into was a need to adjust how you approach health coach visits. These aren't counseling visits where patients sit for a long time and work through with a therapist things that have been bothering them. These are short and targeted skill building visits to help patients achieve goals either from a physical health or a mental health diagnoses.
The visits are about 20 to 30 minutes. They're very short term, giving the patient very concrete behavioral interventions to try. During that process, we might identify other domains of health that this person is struggling in, where if we were to just make that connection for them and hook them up with certain agencies, maybe food security or transportation, and we can make that call in the session with them, a lot of times we can pick up those people that might be falling through the gaps.
It continues to be an area of need. We actually have quite a large severely and persistently mentally ill SPMI population here, including 3 residential facilities. There's a significant proportion of the population that has and struggles with mental illness in addition or separate from physical illness. And so that interplay is present in at least half of the visits I do every day.
We work heavily with a lot of different agencies within the community. So we obviously work with mental health because a lot of times when we are working with people around health issues, we find mental health issues like depression or anxiety. So it can go so many different directions.
The workspace is set up for team-based care, and it is open in nature. So there are no office spaces with closed doors except for one in our space. Our care team consists of referrals and prescription management and triage. We have providers sitting next to medical assistants, sitting next to pharmacists, sitting next to acupuncturists, sitting next to behavioral health coaches. It definitely has enabled us to do team-based care in this workspace.
We instituted a measurement tool called the PAM, and we administered the PAM very routinely initially, and then 3, 6 months, 9 months, and a year. And over time, we were able to track a person's activation or readiness for change and how motivated they are to take accountability for that change. And over time, we had a very positive increase in the PAM results. I would say diabetes has been our best, and I would say smoking cessation has been our most difficult.
So some data emerged that made us go, whoa, we need to change our quality improvement processes in terms of how data is entered. And one of those had to do with how we defined start date, how we defined what enrollment was. That was a particular key piece. And we had to sort of mid-course stop and say, we don't think we have this really defined accurately. We need to go back and do some tighter processes in terms of protocols for what that looks like and how we record that.
I actually think we had really great people that we integrated in, and they fit really well into our team. Figuring out how to sell the patients on it was a little difficult in the beginning. Once they started going, they got it, and they really appreciated the team effort.
And staff, we've utilized it quite a bit ourselves. I think that's another part of it, is we can say this really does work. We've experienced it.
Mm-hmm.
The reason this is successful is because it was a collaborative effort. We've got to collaborate with one another in order to be able to make the changes we need to make. Any single entity typically doesn't have the resource or the ability to navigate larger scale changes.
I think the thing that I want other clinicians to know is that my stress level dropped 300% when we did this integration. It's been a great addition. Patients love it, but I love it too.